Hi, welcome to Golden Years. I'm Lori Betts. My special guest this month is Krista Wasowski from Medina County Health Department. So come on back and she's going to let us know what is happening.
Everything's expensive these days. Food, gas. No matter how hard I work, my paycheck barely covers the essentials. But the real ripoff? Smoking. Because it's not just the price of the pack, it's the breathing problems and the high chance of cancer. That's why I called the Quit line. It's free, and the one-on-one support from a coach helped me create my own quit plan. So when you're tired of cigarettes ripping you off, call 1-800-QUIT-NOW.
Welcome back to Golden Years. This month I am interviewing Krista Wasowski from the Medina County Health Department. And she's going to give us some updates, and she's going to let us know what is available at the health department if you're not even aware of. So Krista, thank you for coming on to the Golden Years.
Thanks for having me, Lori. I really appreciate that. It's nice to spend time together.
Yes, really. So I'm going to start out. I want to know, what was your background before you got into the health department?
Oh gosh, I've been in public health my whole adult career. I've been in public health over 30 years. So I know.
It's a long time.
I know. I've been your health commissioner. This is my 11th year, going into my 12th year as your health commissioner. I was a health commissioner for 7 years down in the Morrow County. And then I was at the Richland County Health Department for 7 years doing health promotion. So.
And did you start out as a nurse, or?
I'm actually a licensed social worker.
Oh,
I've always maintained my social work license. Yeah. It was in undergrad. I had a professor who was both a social worker and someone who worked in public health, and it just really clicked with me, the ability to work with organizations and groups to build healthy communities. It was just really something of interest to me. So.
Well, very good. Well, then welcome to Medina after 12 years. That's phenomenal.
I love being here. You know, my husband's from here. My husband grew up in Brunswick. So it was really kind of coming home. We have family in the county and we have friends in the county. So it was a natural progression, and I really love being here.
So did you pick the family up and go to the other county?
We always lived in Mansfield. So Mansfield was our base. Okay. And we lived in Mansfield for 20 years before we moved up here to Medina.
Well, I'm glad you came to Medina.
Yeah, me too.
So let's talk about the health department. Yeah. What goes on in that busy building?
Oh my gosh. So there's so many programs that happen in the building, but we have even more programs that happen outside of the building. So in the building, of course, we have our Women, Infants, and Children clinic, which, you know, historically you think of young families, but we have more grandparents who have custody of grandchildren who come in and are able to use WIC. So it's really all generations coming in for WIC, children up until the age of 5. And then we have our primary medical clinic that we operate. So all the, wellness, primary medical care, your screenings, all your health screenings, things like that, diabetes management. And then we also have our dental clinic. And our dental clinic has just been around for a very long time, even before our medical clinic. So we have 6 operatories, we have a dentist and a dental hygienist, and you can come cleanings, fillings, dentures, the whole 9 yards. And we do, services we provide are on a sliding fee scale.
Wow.
Yeah.
So the dental clinic, is that
all
like
ages? Mm-hmm.
Is that like low key, or do you advertise that? Or?
You know, we do. I think we advertise it, but I think we advertise everything we do. But I'm always surprised when people say, "I didn't even know you had a health clinic. I didn't even know you had a dental clinic." Well,
so, that's why you're here today.
Yeah, that's why we're here today. Yeah,
you have to tell the Medina County residents what is available for them.
Yeah.
And ages. So
because dental care really began, back Medicare and the no benefit for certain services, and certainly having good oral health, that can affect the rest of your health. And so, you know, from an infection standpoint, but also from like a nutrition standpoint, you know, if your teeth hurt or you can't chew, it limits what you're going to be able to eat or what you're interested in eating. And that affects people's nutrition. So when the clinic began, we saw a lot of seniors, but now today we see people of all ages that come in, because now, you know, we bill Medicaid, we bill Medicare Advantage plans. Some of them have benefits now for dental. We do customary insurance, things like that people get through their employers. So we have folks that started out with us, maybe that didn't have coverage, that have just stayed with us over the years, that have coverage now, and we're their dental home.
Wow.
Yeah.
That is phenomenal.
Yeah. And on our medical side, you know, we also have a clinic. We have our main clinic on Ledgewood Drive, right across from Walmart in Medina.
Right. I've been there.
But we also have a facility down in Wadsworth. So we have a Wadsworth for, not for dental care, but for medical care. We're in the SUMA building down in Wadsworth. We've been down there right before COVID. We had a ribbon cutting. So we still have, we have services down there, and we see people for primary care down there.
Wow. Yeah. I was at, when we had GTB, I was at a couple of your health fairs.
Oh yeah.
Back in the day.
Oh my gosh, yeah.
Yes.
Used to have huge health fairs. Yeah.
Yeah. And then things changed.
Changed.
And then,
yeah, that has changed over time. Yeah.
So.
But we still do a lot. But we still do a lot of other things. We do a big farmers market for families with
on site or
with our. We have a day a year that we do that, and we have special coupons and things like that. And so we still go out. We tend more now, instead of hosting big health fairs, we participate in a lot of different events and things. You'll see us all over the county.
And trying to get the word out.
Trying to get the word out, yeah, for those. But then there are things that we do outside of our four walls too. We do newborn home visits. We go out and visit moms and new babies in the county. And people don't live close by family necessarily anymore, where you have your mom or your aunt or someone that you can, you know. So our nurses will go out and we do visits. We do early intervention with the Board of DD. We go out and do early intervention assessments. We have a Bureau for Children with Medical Handicaps program. If families have a child that they think may have a serious medical condition, we can help with diagnostics, and then we can help, there's a state fund that we can help them access for equipment and things like that. So we do that program. But there's so many different things that happen at the health department that people are usually pretty amazed.
And I know Greg and I walked in there because we were getting our passports.
Our travel clinic.
Yes, so we had to go get paperwork done there. And it was nice because even though we're in Cuyahoga, and then you have to go to the big house, you have to go downtown. So they said, you could just go to Medina. Yeah. I said,
yep, we can do statewide. So regardless of where someone was born in Ohio, you can come to us for birth certificates.
That's awesome.
Yeah. If you have family members that live outside of this viewing area even, they can call in. We do overnight. We do regular mail. We'll mail you a birth certificate.
Very good to know.
Yeah, we actually do a lot of service for people who don't bring their records with them when they're on a cruise ship. Cruise ships can call us, and we can do ship to shore verifying for Ohio residents. We do a lot of that during certain times of the year.
Oh, wow. Who would have thought?
I know. Your health department. We're here for you.
That's good. That's good to know. All right, let's touch. I don't know if I'm going to be walking on eggs or not, but the COVID world.
I told you could ask me anything, Lori, so that's okay. Yeah.
Okay, so when the big hike was going on and we didn't know what was going on and the world got shut down.
Yeah.
What were you thinking and going through? I saw you a couple times on 100 Plus on the Zoom meetings.
Oh, yeah, on our Zoom meetings.
You looked exhausted. You really did.
Yeah. Well, I was. But it was important to still stay connected. And I think that for me, you know, going into all of it, the health department had so many partnerships. We work with so many groups, like through Safe Communities. We work with with our police and with our fire, and with a lot of our groups that we were involved with prior to COVID, like the Opiate Task Force and the Suicide Coalition, and a lot of different groups. You know, we had connections, and so it was a good thing because everybody knew my number. It's a bad thing because they were really long days, but in all seriousness, the health department's role in all of it was really to communicate out to the public, what we knew, what we were seeing with local testing, what we were seeing locally with local hospitalizations and illnesses, what we were seeing with some of our efforts to prevent spread, how that was successful or where we needed to adjust. And there was just a lot of noise happening at the, you know what I mean? At the federal level, in the world, even, at the state level or around. And so we really tried to kind of be that steady, here's everything that's happening. And from what we've kind of discerned from everything, this is what we think is what we need to do. And I put out that Tuesday letter every Tuesday for a year and a half, just as a way to communicate with the public and to reassure them that we were monitoring and we were doing everything we could to return normalcy and to keep our businesses vibrant and to keep our kids in school. And at the same time, to balance that out with frankly, the lives of some of our older citizens, with people who had health issues. And that was really, that was that balance.
And
that I really saw it the whole time with something that we just didn't know. And that's where we kept trying to say to folks, we've never seen this. We've seen other viruses that have eventually evolved into what they are today, rather innocuous coronavirus type viruses, but this is something new. We didn't exactly know how it spread. Remember the very beginning? Didn't know. We didn't know how to treat it. We didn't have it took time, and our amazing medical professionals to figure out the best way to treat it, the right medications, the right vitamins, the right everything. And then what are the long-term effects? What is it going to make you ultimately susceptible to? And I think that was in that middle period, really when we still had a lot of measures in schools with masks and everything. It was really to protect and keep it from spreading among our children, because you don't know. And we still, those are things that take time. You learn that over time. And that's something that you can't rush that. And so you have to take that into consideration and again, balance all of that out.
And then you had the little ones in the schools. Then you had our seniors in the nursing homes and the assisted livings. And that whole thing was just horrible because of the fact that families couldn't go in.
The isolation, absolutely. And also for families, the concern about, what's happening if I can't put my eyes on my mom or on my aunt or my grandma. And it was really hard. But I'll tell you, we have some excellent facilities in Medina County. We stayed in very close touch with them, and even when there was a lot of illness in one facility or another, they were right on it and eager to talk with us about ways to protect the other residents, and they were really creative in ways that they were able to do visits and to reopen, and I think that's one thing with COVID is that there are some things that we put into place or tried or had to do differently just by design that we're still doing now. Like I talked with the fair. I mean, that when we had the year with trying to have the fair and trying to make a good experience for kids, and but some of the things were actually good changes. Having things on Facebook Live, grandparents far away, or people could participate differently. There are a lot of adjustments and things that we did differently because of COVID that are still kind of sticking around because it made things more accessible, or it made things easier for people to be a part of something. So it's kind of a silver lining, I suppose.
True.
For some things. You have to look for a silver lining sometimes.
And I'm sure it's not going to go away completely because now we have different variants.
Yeah, and we knew that would happen, like variants and how that would transpire. But we saw that initially. We saw early flu season, and we saw kind of that spike in some COVID at the beginning, and then we saw a big drop off, which we were really glad to see. That's what they saw down in Australia. We were kind of crossing our fingers because our seasons are flipped. But ours was occurring, with the layer of Thanksgiving and Christmas. So would we really see what they saw in cases when we were having natural times of gathering? You know?
Yeah.
So,
Yeah.
So we still, I mean, we have about, you know, we see cases, you know, that come in. There's not as much PCR testing, but there's some testing happening, and we're seeing, you know, moderate spread, but we're not seeing as much serious illness, and we have very high vaccination numbers in our county. Our 60 plus are very vaccinated. We have
That's good.
like 80% and 94% full initial series vaccinated in those like 60 to 79 and 80 plus age groups.
And you're
which
still
is
going to have the
protective.
believers and the non-believers. So
Yeah, well, and we've always said that that's something for people to make that personal decision about. Do they feel that they're at risk from a bad complication from COVID or not? And that's really not unlike all of our vaccines that we have available. Some people have never had the shingles vaccine and would never accept that. Other people have seen and have experienced how painful shingles are and don't ever want to have that, you know?
Yeah. Oh, yeah.
So, so we know that. But we still have our clinics available. We're still doing the new booster, and we have that available.
Well, that's good. That's good. We're going to take a
Absolutely.
quick break right now,
Yeah.
and then we're going to come back. Come on back, and Krista's going to keep updating about what is going on.
I don't know why you're so sad. You've got a roof over your head.
You gotta stop with that depression stuff. That's what white people think. You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
Guys, cool, look, there's a huge bat up there.
Look at the size of that thing.
Oh, that's truly amazing.
Oh, that reminds me. My favorite show's on Bat tonight. Oh, I gotta go home and watch that.
Welcome back to Golden Years. I am interviewing Krista from our own Medina County Health Department. So again, thanks for being here, because you are just feeding with all this wonderful information. So that's good. And education is what we need with everybody's health issues, whether it's minor, whether it's it's really
We want
involved.
everybody to be healthy. We want
Yes,
everybody
healthy.
to be as healthy as they can be. Absolutely.
That's your goal.
Yeah.
So you have a new program, the tobacco program. Share with my viewers what that is all about.
Yeah, so before this was something that we were seeing just before COVID. Vape, you know, kids. Oh my gosh, it was really just everywhere. And we worked very closely with our schools and with our courts about vaping and intervention when kids were vaping in schools and things like that. So.
Has that quieted down?
It has. It has. You know, I think that's due a lot to education.
Okay.
You know, when it first came out, people did not realize that you had the equivalent of a pack of cigarettes of nicotine in one vape cartridge. People didn't know that. And as we started really educating about that and talking about what were in those cartridges and why that could really be harmful, that became something that just from an awareness level. But we have a program now that we're doing with teens, and we're doing it. It's a my quit. They can text. You know, it's really using that new technology. They can text to a number, and they can start their own quit plan to reduce their vaping, or if they're using tobacco, to reduce their tobacco use to nothing. And we also have the quit line. So we have the Ohio quit line, and or beginning of the year is a time where people make a lot of resolutions for their health. And so January is a time where you have a lot of, a lot of times people try it without a lot of other support, and you may be getting closer to February or into February and think, this isn't kind of how I thought I'd be doing. Certainly with tobacco, there's a lot of resources that we have available at the health department. If you go to medinahealth.org under people, there's an entire tab for employers, for individuals, for parents, teens, a lot of information, and you'll see with a lot of social media promotion right now in the beginning of the year around those tools that we can have available at no charge to help people quit or reduce their tobacco intake for their health.
I might need that for my husband.
Yeah, anybody can access it, so you have Greg just...
All right, okay, I'm going to teach him real quick. So that is becoming very popular?
It is, and it's one of those programs that we really, we see, we can monitor and see tobacco sales in the county, and so we see how much tobacco is purchased. And we know, from talking with individuals who smoke, it's a costly. It costs a lot of money.
Oh my.
So at this time, it might be something people might say, I don't really want to give it up, but I really need to not smoke as much for financial reasons or for health reasons of other people who live with me, or for a lot of different things. And so we, as the health department, just really want to meet people where they are and try to help them do what they want to do in terms of tobacco use. So that's why we have those programs available.
And like you said, the text part of it. I mean, that's what the kids are doing.
That's what they do. Yeah. I mean, you got kids, you text them like upstairs, or you're coming down to dinner,
Lazy.
Use the technology. Meet people where they're at. Yeah, that's for sure.
But that's the way the kids are doing it now. It's just amazing, because you don't pick up the phone and call,
I text texting. Yeah, I text my children. Yes. All the time.
Sometimes as a parent, though, you might get a better answer because they'll string you along when they're trying to talk to you.
This is true. Have you met my boys?
Okay, so what is the opioid program? I heard there was a new program out there.
So we have had Project Dawn. It's called Death Avoided with Naloxone, and that is a reversal for opioid overdose. And we've had that for many years here in the county. But a new program, or a new way that we're doing that now, we have the ability, and we've changed, this was something that we changed because of COVID. People couldn't always come down to our office or get up to our office, depending on where you're at, or over, depending on where you're at in the county, to come over for training and education and for us to dispense it to them. So now we have a way, if you go to our website, you can simply watch the video on your phone or on a computer at home, and then you put your name in and you click the button to tell us that you watched the video, and we can simply mail you the naloxone.
Wow.
Yeah. So it's good. It reduces the barrier of having to travel to us. It's also a way for people who may not want someone to know or want somebody to see them. I mean, people come into our health department for all sorts of reasons. You can make up any reason under the sun. You can say you're bringing in, a tick for identification. Nobody would know why you're walking into my building, but people, but we do recognize that sometimes people want something a little bit more private. And so we developed this program here in the county to get that out. And we now have we call it the hub and spoke mechanism. We work with many different organizations who have naloxone, and they themselves can dispense it to people and then just let us know what they've given out. So, because it doesn't, for it to sit on a shelf at my health department, it doesn't save a life. What saves a life is having that in someone's hands when they come on somebody who has knowingly or unknowingly with fentanyl in different products and things now. It's very scary with some of that. We have some great law enforcement who are really, really doing a wonderful job with investigating and trying to cut down on that flow into our communities. But this Project Dawn is a way to save a life. So that's something that we have available. We really want people to know about it, and we want people to use it. We want to get,
definitely.
Yeah, we want to get that to them. It's no cost.
Okay. Yeah. I mean, are the drugs still, what do I want to say, high usage, or has that toned down? Or?
Yeah, I think drugs are always going to be, and which one and how and where. Those things may change or shift a little bit, but you know, I think it really comes back to that underlying time when people first start using drugs, and that's that primary prevention that's so important. Recognizing when people are in distress, or encouraging people to seek mental health counseling, and you know what I mean, for unresolved trauma and things like that, so that they don't feel like escaping from their lives. You know, that they have the support, they have the community support, and that's important. That really is important.
Yeah, because when they get involved in that mess, they just probably think they're alone, and there's no, who's going to help me get out of this? Is there anyone who cares? Yes, that's phenomenal. You guys are really busy.
We are busy.
I always say that about Medina. Medina is so giving to their residents.
Yes.
So, and the programs are just phenomenal.
There are. You could fill your roster with all sorts of the programs that are available in this county. Really good people doing good things to help their neighbors. Yeah.
So, what good words and advice do you want to leave my viewers about the health department? That, like you said, people could come in, they don't have to know why you're walking in the door.
Yeah. What I really want to leave your viewers with is this. Beginning of the year is a great time to develop good health habits. And one of the most important things that people can do is to know their numbers, to know their blood pressure, to know their blood sugar. You know, those are things that can really have long-lasting effects on their health. And so I would really encourage people to don't put off going to see your primary care doctor. Don't put off that preventative mammogram or maybe a colonoscopy that you know you should have gotten at a certain age and have it. Now's the time. And if you don't have a medical provider, call the health department. We are here for you. We will serve anyone who gives us a call. And our goal is really to promote good health throughout our county.
That is awesome, awesome. Now, I don't know if you have done this in the past. Can seniors come in and just get their blood pressure taken?
You know, we don't have a drop-in, but that's sort of interesting. Maybe that's something we should consider during February because it's Heart Health Month.
Well, yes,
you should think about that. Yeah.
And then just a little bit of education.
I'll talk to our nurses about that.
Yeah. Know your health, know your body.
Know your body, know your
everyone
numbers.
Keeps saying, oh, I kind of felt different, but I just didn't want to call my doctor and ask him this or ask him that. So you got to take care of yourself.
Don't put it off. Take care of yourself for yourself and your family.
Good. Yeah. Very good advice. Well, thank you, Krista, for being on my show.
It's so nice to talk to you.
Yes, and it was great seeing you.
Good to see you.
And again, your levy passed this year.
It did. Oh my goodness, it did. And I cannot thank voters enough for that. Truly, it's a third of our budget, our levy, and it really makes the difference. All the programs that I talked about, every program of the health department in some way has some degree of offset with local money. So can't thank voters enough for that, truly.
Good. And you are the go-to place because you know all the statistics. You know what is going on with every area.
We try to put everything out onto our website. We have a whole segment called Data Reports. And what we know, we want everybody to know about the health status and what's happening within our county.
And you sound like, just listening to you talk, you really love what you do.
I do.
So thank you for being our health commissioner.
Thanks, Lori. Appreciate that.
And you take care.
Thanks.
And thank you for joining us this month. And take Krista's advice. Get yourself out there. Call your doctor. Do your testing because you are in control of your own body. So thank you, and we'll see you next month.